used to think that nurses would assist doctors during taking care of patients, and they would mainly help elderly people.
Usually attend to patient. Yeah, we usually know that they change diaper, give medication.
Caring for patients or people who are in need.
As an advanced practice nurse working at Singapore General Hospital Population Health and Integrated Care Office, my team and I are involved in the discharge planning, care coordination and care transition of patients.
Actually do more than that. Other than changing diapers, I'm responsible for the well-being of my patients under my care, including administering medication, maintaining infection control, performing clinical assessments, and contributing to patients' care plans. I'm also a mentor to nursing students and new staff, teaching them what routines, procedures, and how to interact with patients and their family.
I'm an assistant nurse clinician working in a multidisciplinary ICU. So as an ICU nurse, I provide critical and specialized care to seriously ill or injured patients. It requires me to be vigilant, alert, and quick in identifying any signs of deterioration and intervening to prevent serious complications in my patients.
Since young, my parents have taught me to help those in need, and what better way to do it than to be a nurse.
I realized early in my career that a desk bound job wasn't for me. Hence, I decided to take up nursing. I also have a desire to help others and wanted to pursue a career that allows me to have daily human interactions.
I joined nursing because I was encouraged by my late aunt. She was also a nurse and she was my role model. I've been in SGH for the past 25 years and I really enjoyed working with my team of nurses. And I find that there's great satisfaction in what I do, especially when I see my patients and their family members recover and they are well taken care of after discharge in the community. And that's what keeps me going and motivated.
In the past 12 years of my nursing journey, it can be quite physically and mentally challenging at times, but every slight recovery of my patients motivates me to strive even better. Being able to witness their recovery and improvements in their quality of life is extremely rewarding.
Seeing the patients that I care for getting better and knowing that I play a significant role, it really makes everything worthwhile. I know it may sound cliche, but hearing the words thank you from the patients gives me a sense of fulfillment, and that is what keeps me going through this journey.
I'm grateful towards SingHealth for taking a proactive approach in nurturing me towards my career goal and taking care of our mental well-being during difficult times.
When I first know my husband, right, I thought he was joking when he said that he was a nurse. So I was like, wow. Because it's not really common, right, to have the male nurse in Singapore. So as years pass, right, I can see that his dedication and he is extremely proud of his work, and the passion was being recognized.
There was an occasion where we were out together and Yin Fang had to be called back to work at the very last minute due to a manpower shortage. So she immediately agreed to the request despite being her rest day. So I felt that her relentless attitude, passion and dedication to her work is extremely admirable.
I am very proud of my mother as she is my role model and she inspires me to help others just as she helps others as a nurse. And I hope to one day work in SingHealth so that I'll be able to help others just like she has done.